Welcome to my channel once again. So as I talked in the last video, I'm going to talk about antihypertensives today. Yes, so kindly subscribe and follow me on my social media, Facebook or Instagram, YouTube as a tutorials Abraham. Leave a comment and you can suggest a topic that you're struggling. We can cover it for you. Just suggest any topic you're struggling. We'll research and provide tutorials. So antihypertensives, drugs used to treat high blood pressure, which is called hypertension. So usually above 140 over an intake. So this is the systolic blood pressure. This is diastolic blood pressure. So the first one, drug affecting the nervous system. So I have beta blockers. They block the beta receptors. How do they work? So they block beta adrenergic receptors, reducing heart rate and contractility. I won't go into detailed mechanism of action because I'm more interested in the clinical aspects. So they block beta receptors, let's say B1, B2, B3. So B1 predominantly found in the heart, yes, and then this one in the airways. So and then we know that blood pressure is equal to cardiac output times total peripheral vascular resistance. So cardiac output is equal to heart rate times the stroke volume. So the inhibition of beta receptors will reduce what we call heart rate. It will be reduced and also contractility, leading to the reduction of the high blood pressure, which is hypertension. So we have what we call cardio selective beta blockers. So they mainly inhibit the B receptor found in the heart. So examples, we have atenolol, metoprolol, we have bisoprolol, esmolol, betaxolol, acebutolol. But the commonly used, which I've seen, atenolol is widely used, metoprolol and bisoprolol. Yes, so atenolol can be given up to, I've seen it being given up to, usually they may start at 25 milligram. This is for atenolol, up to 100 milligram once a day. Yes, and then for metoprolol, they can give up to between 50 to 200 milligram in divided doses. So under non-selective, we have the commonly used. So this non-selective, they bind to all, they can bind to all beta receptors, 2 or 3. So we have propranolol, we have nadolol, we have timolol. Timolol is used in eye conditions, so is given as eye drop. We have pindolol, sotalol, and then we also have this carvedilol, wide use in heart failure. Carvedilol, though it binds both to alpha and beta receptors. So propranolol can be started at 20 milligram, can even be given, I think, I'm not really sure, but up to it should be 600 milligram in a day. And also it's used in hyperthyroidism, because in hyperthyroidism there's it affects even the heart. Yes, what do you use? So we have also what we call alpha receptor blockers. So alpha receptor blockers, they block the alpha adrenergic receptors, causing vasodilatation. So other research, they say they cause what we call peripheral vasodilatation. So that's why they are common use in what we call peripheral vascular disease. So it's a selective. We have doxazosin, prazosin, terazosin, alfazosin, tamsulosin, silodosin. Tamsulosin is also used, commonly used in what we call benign prostatic hypertrophy, condition affecting commonly in elderly. It affects the urinary system. So non-selective, we have phentolamine, phenoxybenzazine. So under beta blockers, I forgot to mention the common side effect. So common side effect of beta blockers, we go back quickly. So we have what we call bradycardia. They can lower the heart rate. We have what we call fatigue or tiredness. We also have what we call bronchospasm for non-selective, especially bronchospasm. Also, we have what we call masking of hypoglycemic symptoms. Masking of hypoglycemic symptoms. And we also have what we call, they say, depression, erectile dysfunction, and also cold extremities. So you may feel cold on your arms, your legs. So continue with the alpha receptors blockers. Alpha receptors blockers, for example, doxazosin can be given from 1 to 16 milligram once daily. And then prazosin can be given from 1 to 5 milligram BD to TDS. Yes, so the common side effects of these drugs, they cause what we call orthostatic hypotension. Orthostatic hypotension. And also they may cause a bit of fatigue as well. These are common side effects: fatigue, headache, and dizziness. Because dizziness happens because they cause what we call peripheral vasodilatation, meaning this is example for human being. So most of the blood will move to this side, to the legs, to the hands. As a result, less blood will remain in the head, leading to dizziness. Yes. Yep. So we have also, the other group is centrally acting agents. The third one, centrally, so this is C, under drug acting on never see centrally acting agents. So under centrally acting agents, we have first we have clonidine. We have also methyl dopa. How do they work? They stimulate alpha-2 adrenergic receptor in the brain, reducing sympathetic outflow, using then cardiac output to be reduced. But for methyl dopa specifically, this is a prodrug, so it's converted into what we call norepinephrine. So it is converted to this. So this is a long neurotransmitter. So the correct, we know we have no epinephrine, but this methyl dopa will be converted to pseudo norepinephrine. As a result, the body will stop producing norepinephrine. All this will cause a reduction in what you call sympathetic outflow. So meaning those catecholamines such as epinephrine. Norepinephrine will be reduced, reduction in cardiac output, and a reduction in high blood pressure. So what are the doses and common side effects? Clonidine can be given from 0.1 to 0.3 milligram BD, and then methyl dopa is commonly used in a condition called preeclampsia, which is one of the hypertensive disorders in pregnancy. So methyl dopa is commonly used in what we call preeclampsia, which is one of the hypertensive disorders in pregnancy. So it can be given from 250 milligram to 500 milligram TDS. Yes. So in preeclampsia, they also add what we call nifedipine. So what nifedipine is a calcium blocker. We'll talk it later. Calcium blocker. So because methyl dopa takes time to exert its effect, so before that, would want to reduce the blood pressure through nifedipine. Yep. So what are the common side effects? So there's sedation, because these are centrally acting, sedation, dry mouth, rebound hypertension, and also they may cause bradycardia. Yep. So we're moving to the another group, second group, which is direct vasodilators. So how do they work? They directly relax vascular muscles leading to vasodilatation. Yes, so there are a number of events I won't go into detail. So they cause they relax vascular smooth muscles leading to vasodilatation. Yes. So we can go into the they're used in hypertension, heart failure, especially in hypertensive emergency. When the blood is too high, especially hydralazine. So examples, we have hydralazine. I've seen it. Actually, I've once given it in the ward, hydralazine. So their blood pressure was, so usually they give hydralazine when the blood, especially when the diastolic blood pressure, the down one is above 110. They give hydralazine. So you have to research why. I won't tell you today. So hydralazine can be given from 10 to 50 milligram 4 times orally. Even IV usually they start, I think, from 5 milligram. I'm not sure about that. And then we have minoxidil. minoxidil. Yes, so minoxidil can be given from 2.5 milligram to 40 milligram oral, OD, or TDS. So what are the side effects? So they cause it reflex tachycardia, and then they can cause fluid retention. They can cause what we call headache, and then hydralazine can cause what we call lupus-like syndrome. Yep. So the other group I'm going to talk about is the drug affecting the renal system, or maybe drug affecting renin angiotensin system. So the first one, you have SC inhibitors. So quickly, we know that there's a protein called the angiotensinogen. Is converted by renin. This is a hormone found in the kidney to angiotensin 1. And then angiotensin 1 is converted by angiotensin converting enzyme to angiotensin 2. Angiotensin 2, you know, that is a potent vasoconstrictor. It causes the release of aldosterone, which results in water and the sodium retention and other events. So angiotensin enzyme, so they block the activity of this enzyme, so preventing the conversion of angiotensin 1 to angiotensin 2. So inhibiting this event, there's no vasoconstriction, no aldosterone release, reducing water retention and sodium retention, and this will cause what we call reduction of what we call blood volume, and also reduction in total peripheral vascular resistance. Yes. So what are examples? Examples, we have enalapril, captopril, lisinopril. Yes, so enalapril can be given from actually 2.5 milligram, especially in patient with renal failure. So 2.5 milligram to actually 40 milligram in divided doses. So lisinopril can be given from 10 to 40 milligram OD. So these ACE inhibitors, they are also widely used in heart failure because they are cardioprotective, renoprotective, renoprotective. Yep. So they are used in hypertension, in heart failure, post-myocardial infarction, diabetic nephropathy. So side effect, they commonly cause persistent dry cough, and then hyperkalemia, high potassium levels in the blood, hyperkalemia, angioedema, and then renal impairment, and then hypotension. Yeah. So we also have angiotensin 2 receptor blockers, angiotensin 2 receptor blockers, e.g. rosartan, candesetan, valsartan, telmisartan. So they block the angiotensin 2 receptors, preventing vasoconstriction and aldosterone release, reduction in blood volume. So losartan can be given up to 100 milligram. So losartan can be given from 50 milligram to 100 milligram. And then valsartan can be given from 80 milligram to 320 milligram. So side effect, they also cause hyperkalemia, dizziness, hypotension, and yep, these are common side effects. So under drug that affect the renin-angiotensin, we have what we call renin inhibitors. So they inhibit activity of renin, reducing the conversion of angiotensinogen to angiotensin 2. So they inhibit the conversion of angiotensinogen to angiotensin 2, to angiotensin 1, sorry. So that will cause, so we know angiotensinogen is converted by renin to angiotensin 2, and then angiotensin converting them to angiotensin 1. So this angiotensin 1 so it should be angiotensin 1, angiotensin 2, sorry. So yes, so this will cause a reduction in vasoconstriction, aldosterone release. As a result, all those events will cause a reduction in blood volume, reducing cardiac output, reducing total peripheral vascular resistance, and reduction in high blood pressure. So a common example we have is ariscarin. Ariscarin, which can be given from 150 to 300 milligram orally. Side effect: GIT, diarrhea, hyperkalemia, angioedema, and renal impairment. And then let's quickly look of calcium channel blockers. Calcium channel blockers, very good in elderly. So they basically inhibit the influx of calcium ions into the cardiac and smooth cells, causing vasodilatation. So they also cause vasodilation. So they're used in hypertension, angina, certain arrhythmias. So examples we have nifedipine, nimodipine, and then we also have amlodipine. So this, they are called I forgotten the group. And then we also have another group under calcium channel blockers consisting of deuterzem, and the verapamil. So nifedipine can be started from 20 milligram, yes, OD. And then amlodipine can be started from 5 to 10 milligram once daily. From 5 to 10 milligram once daily. So nifedipine can be given up to 80 milligram. And then dituzem can be given from 120 to 320 milligram doses. So side effects, they may cause constipation, especially this group of nifedipine, amlodipine, constipation, headache, bradycardia. Yes, it's a common side effect. And then lastly, I'm going to talk about diuretics. Diuretics, very important. Diuretics. So they cause diuresis. So increasing excretion of fluids. So promote the excretion of sodium and water, reducing blood volume and vascular resistance. So this they promote excretion of sodium, especially sodium, and water. So reducing that water retention and sodium retention, reducing in blood volume. So cause a reduction in cardiac output, BP is lowered. So usually they're used in hypertension. It's normal hypertension. Okay, before we go that, so examples of what we call thiazide diuretics. So this is they block the distal convoluted tube. It's preventing the reabsorption of sodium. Yep, so we have hydrochlorothiazide. Yep, so can be given from 12.5 milligram to 50 milligram once day. And usually Thiadex, like they're combined with other antihypertensive. For example, there is combination called teomesetane plus hydrochlorothiazide. So this is a angiotensin 2 blocker, and then is the thiazide. So common known as Thelma H. Yep. Yeah. And then we also have what we call loop diuretics. So example is the furosemide, common known as Lasix, used in hypertension with heart failure or just in heart failure. This one can be given from 20 milligram to 1.5 gram, especially IV. For example, if a patient has got what you call anasaka, accumulation of fluid in the gastrointestinal tract, so give IV higher doses. But orally can be given from 20 milligram up to 160 milligram. So we also have what we call potassium sparing diuretics, such as spironolactone. Potassium sparing diuretics, such as spironolactone. Other literature group this as the aldosterone antagonist. Yes, it inhibits aldosterone, causes reduction in water retention and the sodium retention. Also we have should be trientylene. Yep. Side effect, hypokalemia. Thiazide and diuretic. Yep. Hypokalemia for thiazide and the rope, and then potassium sparing, they cause hyponatremia dehydration and dizziness. This is what I had for you. Yes, the video is very long, but it's worth it. Leave your comment. We did there are a lot of information that we have left, but I can, if you ask, I can email you the notes. Yes, I can prepare notes for you and email. So just subscribe and share this video tutorial. Tutorials Abraham. Yes, subscribe and follow me. Yes, if you're not a student, if you're a student in nursing, pharmacy, medicine, physiotherapy, environmental health, just inbox me or email me. Yes, thank you so much and God bless you.